It's my honor to be speaking to you today. I'm Todd Albert. I'm a Surgeon-in-Chief Emeritus at Hospital for Special Surgery, and I'm a Professor of Orthopedic Surgery at Weill Cornell Medical Center. I've also been past president of the Scoliosis Research Society and past president of the Cervical Spine Research Society. I'm really, truly honored to be part of the National Spine Health Foundation because I think it's so important that patients have a voice. They have a voice and they have a place to ask questions, to learn from, to get their advocacy from, because it can be a lonely place having a problem, not understanding exactly every bit about it, but also not having others that have the same problem. And I think that's the most useful thing, to be a sounding board or at least a gathering place where patients can come together, understand each other's problem, and be a sensitive voice for it. And the people who are on this board, I think all feel the same way. So patients should feel very comfortable that they have a group that's advocating for them and trying to educate, provide education for them as well. My favorite part of my job is really interacting with patients. It's the reason I went into medicine at the beginning. I thought I was going to be a family doctor, and I ended up being really lucky, becoming an orthopedic surgeon, becoming a spine surgeon. But still, it remains to this day, with all the things I've done, all the things I've been able to accomplish, being one-on-one with patients and being able to understand their problems, being able to help them with their problems is really the most fun part of my job. The other part that I do love is mentoring younger doctors and our students to be able to go forward in this career, and also to be able to help them understand the beauty of the patient-doctor relationship and what they can achieve by being really close to their patients. My area of specialization within spine health is cervical spine, is the neck. And I love that. I love cervical spine, because of the delicacy and the intricacy of the anatomy, and quite frankly, because the outcomes of the surgical interventions are so good. The diseases within cervical spine can be so severe, or the disability can be so severe, but yet what the impact we can have on patients' lives is amazing. And also, selfishly, the patients get better when things go well, get better so quickly that selfishly, we like to see our results more quickly than less quickly. And that's the other reason I love cervical spine surgery. Another interest within spinal health and spinal surgery is in the basic science mode, how can we prevent discs from degenerating? And I've done a lot of basic research through the years and continue on how we can regenerate degenerating discs. In other words, looking for a fountain of youth. And we have NIH-funded laboratory doing that, but it may be years away, but we continue to plug away at that problem. Well, I think the next exciting frontier for spine is really going to be robotics and increasing minimization of our interventions. And what I mean by that is we're doing things through less and less incision or less invasiveness. And that's only good if we can still achieve the same results for patients as we do with open surgery. But I really have to say that I think we're getting closer and closer to achieving that aspirational goal, meaning patients can achieve beautiful results with spinal interventions with less injury to them in providing that care. And doing so is so rewarding. And hopefully, eventually, we'll be able to give patients injections or a pill where they won't even need to have surgery. but I think that's a long way off. But we're working toward that goal. So I think COVID is affecting spine patients first in having people, when we were in the real height of the pandemic, at least here in New York City, people did not want to understandably come to a hospital, didn't want to come to a hospital in the city. And I think people in general, and perhaps still, are neglecting their overall health problems because all they have is telehealth. Not that telehealth isn't fantastic, but they're less likely to take care of things that are everyday things they would have previously taken care of, but now because of COVID, they're not taken care of. And what ends up happening is it can build up. It can build up when they're not doing their preventative health. As for the spine, I have not really seen directly in my patient population, because mostly I see surgical patients, so I haven't seen patients who have problems from being on the computer too much because they're doing only things on the computer in isolation. But I will tell you, I can guarantee that isolation will cause increased depression, and that will lead to increased pain for whatever the underlying disorder is that may be provoking pain in patients. So I expect that to be a bigger problem. I am a huge fan of telehealth. If we're talking about telehealth, I think it has made such a positive impact. It is one of the positive things that have come from this COVID crisis. The reason I say that is we can do so much in terms of initial evaluations of patients by having the appropriate imaging study, being able to interact with them face-to-face, even if through a computer screen, and even examine them with limited facility through telehealth. And it is so nice for patients who would have previously had to drive an hour, pay for parking, wait in my waiting room, and then drive an hour home or more, to be able to gather the information ahead of time, not be anxious about exposing themselves to the outside world or to other people who may get them infected with COVID or something, and to be able to sit in the comfort of their home and get the diagnosis. To me, that's the positive of telehealth. And honestly, if you said, well, tell me the negative, I don't see a big negative, except that it may prevent people from getting help they need to have face-to-face. But I think if we tell patients, this has been great, but I have to see you, they will still come and do the visit in person that they must do. And I'm a believer that for most things, I'd like to see them live once before, if they need surgery, before we subject them to surgery.